introduce?
Okay, no problem. Yeah, sure. Yeah, thanks.
One second.
Gina, can we go ahead? Gina, can we go ahead?
Second. Yeah.
We can go ahead. Yeah. Good afternoon, everybody. Welcome to today's session of Vayomanasa Sanjeevani. I think today we are all lucky to have Dr. Dominic G. Benjimin. He's a very senior geriatric physician. I think there are very limited geriatricians in the country as well as in Bangalore. And he's one of the most accomplished geriatric physicians and who has a rich experience of catering to the needs of elderly people. As you know, elderly have many health problems, and geriatricians are trained to look at a holistic picture, and then to look at how health has to be, and that's how health has to be handled. So it is not everything has to be specialist driven, and each systems to be looked at separately. And the geriatricians have a very crucial role in the care and maintaining the health of elderly. And despite and it's also time now we are learning that COVID is actually having a lot of effect on the general health system. Even though people know it is pneumonia, it is not something. There are a lot of unknowns we have. It can affect multiple systems. We do get people affecting with psychological or psychiatric problems. We do have people affecting brain in other ways like delirium, and there is also effect on heart. The other systems we probably will learn over a period of time. It probably is a systemic problem, and I think at this point of time, another major thing is that many elderly who would be routinely visiting doctors for maintaining their chronic health conditions may have problem because of may have problem to access routine health care, because the priority is to safeguard themselves from COVID. So in that condition, many times people are going to teleconsultations. That's also many of the hospitals are giving, but still it's a challenge. The elderly may have a lot of concerns and questions as to how, what to postpone, what not to postpone, how much I can take a risk, or which is a priority at this point of time. There may be several questions. I think we cannot have any other person better than Dr. Dominic to address these concerns. Dr. Dominic is practicing geriatrician in the Baptist Hospital. He has been trained in UK in the geriatrics, and he is a person who is interested in Alzheimer's also. And that's how we, as a part of RC, we are all colleagues working towards the kind of advocating for the cause of dementia. And Dr. Dominic, I think thank you very much for accepting our invitation and being there. And so this program, Vayomanasa Sanjeevani, is coordinated by our volunteers. Actually, today, Ms. Sakuntala Madam, I think, Gina, can you put a spotlight on Sakuntala Madam also? She is one of our active volunteers. She is the actual host for the program. And they are actually a group of active volunteers. And actually, we are trying to decentralize it so that they can actually post questions which are not specialist driven. It is a general person driven. So they have a set of questions which to ask you, I think, once your talk is over.
Yeah.
And it's over to you, Shakuntala Madam and Dr. Benjamin. We look forward to the session. And this also program is kind of live in the YouTube. It will be shared subsequently in the Vayomanasa Sanjeevani channel. And people can access this information even after this program. Thank you,
sir. Thank you very much. On behalf of Dr. P.T. Shivkumar and Vayomanasa Sanjeevani, I welcome you, sir. Over to you. I'll ask questions later, sir.
Sure, you're most welcome. Most welcome. Good afternoon, and thank you for Vayomanasa Sanjeevani group to invite me, and thank you, Dr. Shivkumar and Madam Shakuntala. So I think we are in unprecedented times, and times where we don't understand what's going on. Pandemic will cause panic. That's why it's called a pandemic. But yes, we got used to new terms called social distancing, which I don't like. It should be physical distancing. There's been a lockdown and there's been a breakdown and a whole lot of things that's happened. So I put my talk in a bit. Where is my talk? How do I get it now? Wait a minute. Let me get my talk. It's in my screen.
Yeah.
How do I access my?
If you just put the share screen, the green button.
Yeah, just hold on. Let me open my presentation and then. Yeah, so I just put my title as very provocative. It's a healthy aging in the changing COVID world. It's not only changing; it's already changed. So I think let me do the share screen now. It'll come up, I think. Oh, it's here. Okay. So is it share? Okay.
Yes.
Is it
coming.
can you see? Okay, fine.
It's visible.
You can make it full screen.
Okay. Yeah, I can make it full screen. I'm trying. Okay, fine. So I just want to make it more fun. I know we can talk about teleconsultation, diabetes, hypertension. We'll talk all about. It's very easy to get what's in the public domain. I'll try to see what is not in the public domain. Our world has become, juggling and playing with these three words called CRP. First, you start PCR to diagnose, then CRP to check whether it's COVID. Then we talk about CPR, whether to resuscitate him, not resuscitate him. So I think a lot of things have changed. But what has not changed are certain facts that, if you look at this graph here, I put a graph on the left side which shows the world in proportion to the land area. And if you see the same picture on the right side, which shows the world map in proportion to the people above 60 years old. So it's a very contrasting one. Why is that? Look at the land area of Africa. It's quite big. But look at the land area of when it's compared to population of older people, Africa has become thin and dehydrated. But look at Japan. Japan is just a squiggle here. Suddenly, Japan has got bloated up. Look at India. India and China has got bloated up. What am I trying to tell you? This is a demographic time bomb. Whether you like it or not, you loathe it or you lump it, you just need to bear with it and accept the fact that that's the way it's going to be. So COVID has affected a lot of older people. But look, what has happened because of COVID? There is a sense of anxiety. There's anxiety in the air. And this is the world's oldest rock band. They were called the Zimmers. The average age was 80 years old. Why did I put it up for all of you? It's never too late to have fun and jingle. The lead singer was 100 years old. Okay, so I think it's good to have fun and jingle, especially in time of COVID. Now, we'll come back to this very profound slide. It talks about two things that we aim in life. One is resume virtues. When I'm growing up, I want my resumes to be super. I want to achieve. I want to excel. I want to attain. I want to get the degrees. I want to get the accolades. But what we realize when we look at this graph here is that it's not the resume virtues that define your happiness. It's your eulogy virtues. What are eulogy? Eulogy is what people talk about when I'm dead in front of me. It's about the relationship that I maintain, the depth of the characters, the relationship that I build, and things that I give to the world that matters. So it's a eulogy virtues that matters, which makes us to be happy. Now, there is a big fallacy in the way we define aging, and especially in COVID times. It's always focused on decline of loss of function. Okay. Now, we always want to perpetuate aging as you're past the self life. It's a contrast, always a contrast to the youth. Youth are like this, you can't be like this. Okay. They exclude the positive experiences and possibilities that the older people bring. Okay. Now, there are wrong standards for success. And they say that if you can't run for a bus, you become old. It's just that it's a comparison. That has nothing to do with old. So I think there's a lot of fallacies in that. So what's aging? Aging is a process of optimizing opportunities for health, participation, and security in order to enhance quality of life as people age. So it's optimizing. Okay. So the hallmark of aging is individual variability, and also factors like genetic, disease, environment affects them. Okay. Now, this is a very profound graph. I just want to spend a minute there with you. There are two worms here. One is a blue worm and one is an orangish worm. Okay. Now, we see that when you come to your early life, if you don't look after your health, it starts dividing much before you finish your 30 years old. You complete 30 years old, and there is a decline. By the time you come to 60 years old, your disability, that means what? You can't walk up to the local shop, you can't run for the bus, you can't climb a flight of stairs. But people who looked after the health, look at the blue worm. It is much, much more healthy and robust. Even when they're in the 70s, they're still very functioning. So what am I trying to tell you? Aging starts very early, and we need to invest on our health much earlier. Okay, now what is health? Three dimensions. I'm sure you'd have had a lot of lectures. It's physical, mental. There are 6, 7 dimensions of health: physical, mental, social, cultural, spiritual, environmental. Okay, so there's so many dimensions of health. But we in medicine, we've been the way we practice medicine is only about the physical health that we talk about. Okay, these are the various dimensions of health: intellectual health, emotional health, physical health, environmental health, and social health. They all contribute to a sense of well-being, a sense of harmony. And what's harmony? What I think, what I feel, and what I say is congruous. That's harmony. Now, these are the common conditions that most of the older people get affected by. 80% of the people above 65 years old have at least one condition, be it hypertension, high cholesterol, arthritis, heart disease, depression, chronic kidney disease, heart failure. Okay. If I'm rushing, please let me know. Okay. Now, this is a very important slide. This is a study which is published in 2017. It tells us how an attitude to health will make all the difference. The good old adage is that it is not your aptitude, it is your attitude that speaks of your altitude to bring about change. Now, if you look at the red worm, the red worm shows that people who are born with disabilities, physical disabilities, the quality of life remains the same because they meet the doctor more often, they keep the functions going. But look at the blue worm. There are people who are very convinced about their health and they really take good care about their health. Now, they do well past the 50. Now, look at the yellow worm, the green worm. The green worm people had a good quality of life when they started life, but their attitude to health was very bad. And look at the decline, what they go through. By the time they come to 45 to 50, they're like people who were born with disabilities, like people who develop congenital disorders or polio. So what I'm trying to tell you, it is your attitude towards your health that is so very profound in terms of your outcome. Now, what are the reasons for poor health in older people in general? And we'll talk about COVID in specific. It's about the chronic disease. Now, what are the chronic diseases that we talk about? The diabetes, the hypertension, the heart disease, the osteoarthritis, rheumatoid arthritis, neurodegenerative disease, a whole lot of diseases, the chronic diseases. They're called as non-communicable disease. What is the difference between, I lived in the Western world for a long time, I trained in the Western world. What's the difference? In the Western world, they are more often challenged by non-communicable disease. Whereas in India, you have a double whammy of both non-communicable disease and communicable disease as well. We still have tuberculosis, we still have a lot of infections. Okay, so it is a double whammy. So chronic disease should be managed. Suppose one gets a diabetes at 40 years old. You need to make sure that you optimize your diabetes and get it under control. By the time you come to 50s and 60s, you're well in control of your diabetes. There's no organ damage. Then your quality of life will be comparable to a person with 50 years old without diabetes. Malnutrition. There is something called anorexia of aging. A lot of people, once they come to 60, they have something happens in their brain. Oh my God, I'm retired. I don't need to eat so much. I can eat less. I'm not going to work. I'm not doing anything. My shelf life is over. So they start eating less. So their protein intake is low. The body mass is low. Compared to Anglo-Saxons or Caucasians at any age group, we have low body mass to start with. Okay, a low protein mass to start with. So we decline very fast. So a 60-year-old man getting admitted to a hospital with pneumonia in UK will recover within 3-4 days and go home, whereas a person here will take weeks and weeks to recover because his buffer is very, 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 very tight. Malnutrition, skipping meals. Well, they do it for many reasons. One is to lose weight. Some people do it for religious reasons. Some people think that if I'm not doing much, why should I eat food? Unbalanced diet. Our South Indian diet, at least, is in carbohydrates in different form. You can eat dosa in the morning, rice in the afternoon, and I don't know, sannas in the evening. I don't know. It's all rice in different forms. So I think we are more carbohydrate people, less protein people. So, and poor sleep hygiene. We'll talk about why sleep is so very paramount. We not only rest in sleep, we also grow in sleep. Now, we know that you can do regular exercises and you can be fit. Physical activity need not be strenuous to achieve health benefit. Okay, the loss of strength and stamina attributed to aging is partly due to reduced physical activity. Okay, now we know that if you live in a family or a social construct where your friends are doing physically active, you're more inclined to be physically active. Okay, exercise is very, very important. Okay, that's something that you need to do. Yeah, I think 30 minutes of walk is good. You can be creative. Yeah, a diet is something which we are very, very bad at. We have a lot of food fads. They say if you eat cucumber, you'll get cold. If you eat brinjal, you get heat. I don't know. There are a lot of food fads in different parts of the world. But I think the problem is that we don't take enough fruits. We don't take vegetables or whole grains. I think we don't drink enough water as well. And one of the things that we make food as a very mundane and a boring thing, whereas we can make it as a very social thing. Studies have shown very clearly that if you cook uppittu and somebody makes wangi bath and you both eat together, not only you eat better, you also enjoy the food because of the coming together. So it's a social event. So I think that's what we don't do. Potluck is something very common. Okay, this is a plate sort of diagram that we have for people who want to just so how much to eat. There should be starch and whole grains, meat and protein. For a vegetarian, there should be a lot of double beans, kidney beans, soya beans, rajma beans, all the beans. A lot of vegetables, piece of fruit, and a yogurt. So I just put a picture of nutrition thing here. Now, simple diet tips is regular meals, healthy snacks, use skim milk, vegetable oil, change cooking methods from to boiled, grilled, and steamed vegetables. Okay. Now, if you are a hypertensive, then you can follow what is called as a DASH diet. Okay, so basically increase the intake of garlic, potato, beetroot, onion, olives, and omega-3 fatty acids. That may help you. So this is what it is. Now, the vice of 20th century was alcohol and smoking. The vice of 21st century is salt and sugar. So salt and sugar will define your quality of life, the longevity of life. Okay. Now, what are the common problems that people are suffering during COVID times? Osteoarthritis because they put on weight, what we call it as a COVID weight, because they're at home, they eat. A lot of people are panicking when they see the news, and we tend to eat more when we panic. And people, when they're down in the spirits, tend to eat more. Okay. Now, what are the other symptoms that people suffer with when they're constipated? Especially men suffer with difficulty to pass urine or initiating urine. Women present with urinary incontinence. Urinary tract infection is more common among women, and urinary infection is a very bad sign if you're a diabetic. A lot of them are very constipated because they don't take water, they don't take high fiber in the diet. There's increased risk of urinary tract infection. Hypertension. How do you control? During COVID times, it's been a poor control. And it's also because of anxiety. A lot of people are anxious. And also weight gain because they're not walking, they're not going for the usual walks and meeting people. Poor sleep and inappropriate diet. So what's happening to COVID with patient diabetes? They're unable to reach their doctor. So they're having poor control of diabetes, poor dietary compliance, weight gain, and HbA1c is not checked, not controlled. Doctor, we can't get the lab to come and test for us. We're not sure what's happening. Sometimes ignorance is bliss. So let's keep going. Well, I think sleep has been one of the biggest, casualties of pandemic time. We know that we not only rest in sleep, we grow in sleep, and this picture illustrates very clearly the giraffe still wants to sleep and keeping a long pillow in the neck for the neck. So I think one of the problems is that people who watch news, and we know from evidence that it takes about 3 hours for your visual images to go out of your head. So if you watch Arnab Goswami at 9 o'clock, 10 o'clock, he's good enough to scare you all through the night. I'm not against Arnab Goswami, but I think they said the way they sensationalize news that everybody dies. The mortality of corona is less than 2%. But the media has projected that C is equal to death, like the C of cancer. Corona is equal to D. C leads to D. So that's how they projected it to. So people go to bed thinking, "Oh, am I getting corona tomorrow morning?" And also WhatsApp The WhatsApp University, as somebody put it this morning, is full of messages about a lot of things, and all the death news goes around. So sleep is disturbed, and a lot of them have a problem of stress diabetes because they're not sleeping. And people have problems with memory because with sleep we help with memory. Coming to memory, memory is the game changer. I'm Dominic only because I have memory. You take away my memory, I don't know who I am, and that's the worst horrible disease that you can. I'm sure Shiv Kumar is an expert on all that. Now, one of the things that has changed a lot of people, there are a lot of people who sort of reach out to us during COVID times. Who are the ones who still do well? Now, people who acknowledge some balance need to be stuck between living in the past, living in the future. Some people understand that we need to do certain things and we don't know what the future holds too. Okay. Now, now people who are in social inclusive families, that means they have support system, they can call upon, they can't talk to, they feel that they're more secure. Okay. Now, reciprocity is antidote for dependence. What do I mean by that? Now, here the problem is that we show love by making people dependent. If I love my father, if he develops a stroke, I'll tell dad, I'll come and feed you breakfast, lunch in your bedroom. But what does it make him feel? It makes him feel that he can't he can't come to the living room. His time is over. He's not part of the family discussion. People who come will visit him in his bedroom and come and talk to the family in the drawing room. So basically what you've done, that you told him, look, your time is over, your self-life is over, I'm just feeding you, and so he's gone. Whereas in Anglo-Saxon community, they'll say, look, dad, I love you, but it's going to cause some pain for you, but I'll make sure that I make you walk from your bedroom to the dining room and we'll have meal together. What does it involve? It involves that you're with the family, you're part of the family discussion, you're consulted, you feel valued and valuable. There's two words that are very, very important for older people. I think managing chronic health disease is also an attitude. A lot of people are very proactive about the health. A lot of people are saying that, look, it's Corona time, take it easy. We all are going through this. So I think it's most of them. And also, people have a lot of strong prejudice about certain ways it works. So I think taking prejudice is a very, very difficult thing. So what are things that you should be worried at any point of time, especially during even being Corona, is unexplained loss of weight, nighttime diarrhea, chronic cough, recurrent falls and near falls, recurrent fainting attacks, stiffness in the muscles, a low impact fracture. Okay, now what is it about Corona? A lot of people see more than actual Corona. It's a fear of Corona, which sort of impacts a lot of people. It's a fear. Am I going to get Corona? Is what impacts a lot of people. And that drives them crazy, and they're sleepless. They don't eat well. They eat erratically. They are very anxious. They were on the edge. They start fighting with family and other family members. So I think it has caused a whole lot of mayhem. Now, it has caused a burden on the healthcare. Definitely, we really could not manage. We've seen a lot of older people dying, younger people dying. There's a lot of family structure. This has come into sharp focus because a lot of children in Bangalore could not access children who are in South Bangalore when they live in North Bangalore because of lockdown. Nobody can meet. The family structure has changed. There was a intergenerational dependency before, but now that is lost. Okay, insurance is a problem. So a lot of them are very grumpy during this time, not very happy. So how much time do you have, Shiv Kumar? I don't know.
I think it is going on well. It is going on well. Please go ahead.
It's going fine. Okay. Now I'm going to a different realm of how people perceive their health during time of Corona. At this point of time, Madam Shakuntala, your perception about yourself will depend upon your state of your physical health, your psychological health, your social relationship, and your spiritual issues that you're dealing with. Okay. Now, what are changes changes out of COVID? They're unable to reach the doctor, poor diet, fear and anxiety, socially distant, and feeling lonely, feeling very lonely. Okay. Now, the social distancing has caused a lot of problems. These are psychosocial changes that they're experiencing: loneliness, anxiety, depression, changing family structure, and of course, emptiness syndrome, which is already there, that got worse. All my children are abroad, doctor. I wish they were here. At least I know there's somebody on the other end of the line. So that's another major challenge that they have. So loneliness is a cancer of the mind. It's one of the most horrible diseases that you can ever suffer with. And the worst part is a lot of people are lonely in a family, in a big family. And it's quite telling what I put it here. I feel lonely every single day of my life. I'm ashamed to accept it to the people who love me. A lot of children don't even tell their parents that they're feeling lonely. They'll say, why are you lonely? Watch telly. But what is a good thing about Corona? A lot of children understood what loneliness is because they were locked down. Okay. They were physically sort of caged in. They understood what it is not to be mobile, not to be accessible outside, not to meet up the friends. So that is a big learning point for a lot of people. Why is loneliness talked about in different forums so much? There's a major study which looked at 2 million people. What they came out was very shocking and staggering. It says that if you're smoking 2 packs of cigarettes, if you're having 3 packs of alcohol every day, you're just lazing and sanding in the couch. You are very obese. It's better than being lonely, because it says that if you are lonely, your risk of dying is much higher than all this put together. So loneliness is such a horrible disease that we don't talk about, and it's an unspoken thing, and they think it's a taboo. If I say to somebody I'm lonely, they say, are you okay? Are you okay? Are you okay? You have all the access to watch television, watch Netflix, and whole lot of things. Now, loneliness was a topic in Davos. Davos is where all the wealthy Mughals meet. And look at this. This is a forum on the first day in Davos 2019. They were talking about loneliness. Why should they be talking about loneliness? Because it impacts all the strata of the society. Now, these are the lot of red campaigns against loneliness. The Red Cross campaign against loneliness. You will not believe, this is the most saddest thing. There are people in Japan, older people, they're so lonely, they commit a crime and come into a prison. Because for weeks on end, they don't get to meet anybody. Okay. Now, loneliness is, we think that we are immune from loneliness. Sorry, we are not. Okay. So, we are lonely. Villages have become lonely. A lot of children are migrated. Cities have become lonely. Our social structures have changed. And a lot of the anxiety, loneliness, depression, and anxiety are 3 musketeers who always go together. You will not believe there was a minister appointed for loneliness. Okay. So I think she's not there, but she was a minister for loneliness. They understood the impact of loneliness, what it can do. Okay. Now, this is something that we all young men should understand. This is a movie called Swedish Theory of Love. It glorified the rugged masculinity and, rugged feminism, where we are okay being alone. But it also projects what happens when you are alone. We don't have a relationship. We don't have a structure. We realize that they become lonely. And a lot of younger people have a myth that older people are lonely. This is a BBC survey of younger people and older people all across the world. And it showed that people of 16 to 24 are more lonely than people above 75. What's the problem with 16 to 24? They know how to connect, but they don't know how to stay connected. Okay. Whereas people in the 75s, they have the set ways. See, I am from Gujarat. I can't meet Kannadigas and talk to them. I speak Kannada. I can't talk to Tamil people. See, that is they entrench in certain prejudices that they can't deal with. Yeah, I think it's not lack of social skills. It's just that we don't want to make friends. We don't want to say hello to people. So how do you define loneliness? Loneliness is defined as a discrepancy between person's desired and actual social relationship. It's an emotional response to social isolation. That means you want to be connected, but you're not able to connect it. Okay, so we know that loneliness increases risk of heart disease, increases the risk of all-time mortality, increased blood pressure, and disability. Mental health, I'm sure Shiv Kumar will agree with me, increases risk of cognitive decline, increases risk of dementia, depression, and suicides. Okay, so I think lonely people are more likely to visit doctor. Can I say this to you honestly? A lot of my patients come here just to say hello to me and have a chat to me and go. I feel so sorry for them. And these people have been high achievers who contributed to the welfare of this country. And when they have to enjoy the harvest of labor, but they have everything to live with, but nothing to live for. And that's not a good place to be in. Okay. So they are the ones who go into the care homes very, very early. Okay. These are the various campaigns to think. Okay. Now, anxiety. Anxiety, it brings about frightful feelings. It is the flight, the fright, and the fright. response which happens with anxiety. What does anxiety do in very small, in a small nutshell? It magnifies uncertainties, minimizes your capability. Shiv Kumar, do you have a son or a daughter?
Yes, both.
Both. Okay, fine. We'll take a daughter as an example. So just say that you're very young. So you have a 18-year-old daughter who's traveled different places, and she goes to a supermarket. She's supposed to come back by 6 o'clock. I know it's not COVID time, non-COVID time, and you don't hear from her. So at 6 o'clock, she's not called you. So you become anxious, and you try to call her. She's put on silent mode. She's not picking up. So what is that, Shivakumar, will you think? I know you will think something else. You'll think, oh my God, what happened to my daughter? Did she meet with an accident? Did she get robbed? Is she in trouble? So you magnify the uncertainty. Okay. Now, for all you know, she must be having a good time with her friends. She met some friends from her school. They gone to the food court and having a good laugh and enjoying the meal. And it minimizes capability. Now, your daughter has been out and about, and she's gone to supermarket many times, and she's come back a bit late. She's capable, but then it makes you feel that, oh, she's not capable at all. She's still my small little girl that she can't manage. So I think that's what anxiety does. Anxiety does, okay, my God, I had a bit of sore throat, doctor. Am I getting corona? So a lot of people ask me this question. Should I start doing betadine gargle regularly? Should I do this? Should I take vitamin C? So how do you prevent it? Any fever during this time is COVID unless proved otherwise. It could be a normal. All the other viruses are not dead and gone. They're not given a place for COVID and said, okay, we go sit down. It's not our time. It is Dhoni's time to play T20 or something. No, there are other, but we become so anxious. So I think we worry about it, and we don't that's what it does. So basically, anxiety and depression can be very difficult to think. They'll be restless, excessive worrying, agitation. I won't go on to this. Okay, we talked about this. Okay, the only thing that is constant in life is change, and everything else is changing. So I think, how do I tell people to deal with, and how I deal with, is focus on things that you're grateful for. Can I say this to you? April and May was the most brutal time for us. We've seen a lot of deaths. I've seen a lot of deaths. A lot of people whom I know died. A lot of younger people have died. A lot of my patients have died. So I'm so grateful that I'm here to tell the story to you. I tell people, you acknowledge and experience the feelings that you go through. Talk to a friend, talk to your family, talk to friends and family whom you think. Accept the things that you can't change. I can't change the shape of my nose, but I have to just accept it and live with it. But things that I can change, I do it. And things you can change, deal with it every day. Well, this is a big thing that a lot of people came about, asking about meaning and death. A lot of people talked about death during this time. As you age, your life will change. You'll gradually lose friends. And this has become a big challenge in the OPD, where a lot of people have lost family. And they are wondering, am I going to die? Is it going to happen to me? Why it happened to me? Is it because of me? One of my colleague lost a father-in-law, and she went through the process of guilt, saying that, did I bring COVID to the family? Did he die because of me? The whole lot of things that we can think. So meaning, and what's the meaning of all this? See, we don't know the reason for the season. I hope once we pass through the season, we will know the reason. I just hope so. Okay. Now, in all this, please laugh, because you need 17 mothers to laugh, 17 mothers to frown, and it helps you. And humor brings about a lot of good things in you. Strike a right balance. A lot of people have reflected on life and said, look, let me stop living in the past. Let me start living now. And, instead of living for the thing, and strike a balance between spending and saving. A lot of them, I lost a young family member who bought a big farm in Anekal Road, and she died of COVID. It sort of wonder why, she spent so much of thing. Yeah. I want to tell you this very important thing. This is one of my most important slides. It's called reminiscing. How do you reminisce? There are different people who reminisce. There are obsessive reminiscer. What is obsessive reminiscer? He'll say, look, this gentleman say, doctor, I was all well, When I was 30 years old, my brother cheated me. And from that time onwards, I developed diabetes, hypertension, my whole life changed. It's all because of my brother doctor. That is obsessive reminiscing. Okay. Escapists is people who have been done well, who have been in charge, like the teachers, the bank managers say, you know what, I had my good times. I used to be in charge of this and those sort of things. And narrative people are most often the teachers who are storytellers. Oh, I used to be like this. I used to do that way. Instructive are people who've been life coaches, who have been they say, okay, I used to deal life lessons like this, but they won't apply them to themselves. Instrumental are people who lived a very regimental life, people who have been OCDs, people who have been very, very regimental in everything they do. These are the very difficult people to manage. Doctor, I'm doing everything. Why is not my blood sugar coming down? Why is not my hypertension coming down? Why am I not losing weight? You told me to do this. I'm doing everything. But it's integrative people. What is integrating? These are the people who understand what happened in the past, they resolve the conflict, deal with it, and they come to terms with it. So different ways of dealing with it. We'll take the first example of a person who was 30 years old, his brother cheated and everything happened. So what is, you do what is called as life review. You go back in life, you evoke the past, use the question saying that, yes, my brother cheated me. Not a good thing to cheat, but my brother was in crisis and he had nobody to cheat except me. So what? He cheated me. It's my brother. But look what life has dealt me. You recall the events of the past and review in detail. Look, although he cheated me, I'm still doing well. I'm done well in life. So you react to the cheating emotionally, but you reframe it and put a new meaning to it. You said, God, you're so good to me. Although he cheated me, I'm still doing well. And you reconcile and say that, okay, my brother cheated me. He didn't mean to do it, but it's just that he had no other choice to do it. But in spite of all that, I'm still doing well. So when I see my brother next time, I'm not bitter about it. I want to get better with him. So I think that's how you think. So I think we don't talk about the eulogy virtues. COVID brought about a very important thing. It is how depth the relationship that you had, the character that you built in, the how valued and valuable you feel, and how strong you are in terms of your spirituality. I want you to read the study. It's called Grant and Gulick study. I don't know how much time do we have. I don't know. We have. Yeah, we have some time. Please read the study. It's one of the fantastic studies. Nobody will talk about it because the CNN doesn't want to talk about it. BBC doesn't want to talk about it because it's just antidote for everything what they say. It's a study which started after Second World War, and human beings had this perennial, unending question: what will make me happy? What will make me happy? So what they did is there were a lot of Irish migrants who went to Massachusetts, and they collected a group of Irish migrants who lived in the inner city in a very low socioeconomic background, and they also took to study another group of people. People from Harvard, the Ivy School people, very top class people. Now, when both Irish migrants and the Harvard group of people believed what will make me happy, money, fame, and success will make me happy. Money, fame, and success. Money, fame, and success. So everybody believed it. Even the investigator believed it. Okay, but what they did is they studied them for every 2 years. They spent 2 days with them. They went through the health records, the relationships, the bank balance, the work records, the sickness records. And people whom they thought will do Nobel Prize, will end up getting Nobel Prize, ended up being not doing well. Some of them ended up in a death row. People whom they thought were average ended up going to the heights. Some of them went on to get Nobel Prize. John F. Kennedy was part of the study. He went on to become the most powerful man in the world, and he dealt with Cuban crisis. And we're talking about all this now because he managed the Cuban crisis so well. So what shocked them was this. They studied this for 50 years, ladies and gentlemen. Please go and read the study. Robert Waldinger gives you a summary in the YouTube. For 50 years, they studied them. They found, what matters for me when I'm 50? It's not my bank balance. It's not my degrees that I have after my name. It is not how much money I have. It is the relationship. It is relationship. How valued and valuable feel at home, with my friends, with my peers, and how purposefully driven I am. That's what will define you. So when they started, they thought it's money. Then they realize it is relationship. And that has come into sharp focus during COVID time. So I want to shoot a question to you. What practical steps you can take to overcome these challenges that you're facing? It could be an anxiety, it could be loneliness, it could be change that you can't accept, Or it could be you're angry about how life is, Corona has dealt your family. How could you use the gift today, what you have, to make a difference to others? How can you maintain and sustain good health to pursue your mission? Whatever it could be. Never duck the existential questions. It so becomes prominent when you are at a certain age, and especially during Corona. I don't know whether you noticed that. The March of last year, the whole of Europe for the first time felt a sense of collective mortality. There's something very unusual happened. First time in the history of in a monarchy, Queen came out and addressed the nation. Queen never addresses the nation. Queen addressed the nation only once during the Christmas lunchtime. This is the first time she's broken the protocol because they had a sense of collective mortality. All my friends in the UK did online will. They did online advanced directive. What if this happens to me? What will I do? Okay. So how do you deal with your local community, your church, your temple? You need to. My take-home message is this: a merry heart is the best medicine. A lot of them are existing. They're not living. The difference is not apples and pears. The difference is chalk and cheese, pots and peas. So what makes the difference, whether you're existing or living? The environment that you live in. If your family is proactive, encouraging, you're more likely to follow the diet. You're more likely to go for an exercise. Okay, the services support that you have access to. If you have access to a hospital, a doctor, a library, you're more likely to use it. A park. Very clearly, the studies are shown in the Western world. If you're close to a park, the incidence of heart disease comes down. Next two words are very key words. How valued and valuable you feel during even Corona time. Your social network. It is not how many friends you have in your Instagram. It's not how many people that you have in your WhatsApp. It is how many people that you can connect and call upon when there is a need. Do you cherish and foster new relationship? Do you long for it? Or you say, no, I'm okay. I can't do all this. I'm too old for it. I can't manage this thing. And your relationship with God, which is so very important. I just want to say this to you. I want to leave you with this story. It's a profound story. Go on. It's about, his name is Edwin Hari. Edwin Hari is a wartime pianist. Okay, he's a jazz pianist, sorry. He's a war veteran. He lived with his wife for 70 long years and she died and he was gutted. So they put him in a nursing home. He almost became a vegetable. He was rotting there. Okay. And then one of his carers started talking to him. Then he realized that he's a jazz pianist. We started talking about music and he started getting excited and started becoming very chirpy and very cheerful. Then they started talking, they got connected, they wrote him off as a patient is dementia, is dying. But in 6 months' time, Edwin Hari started playing the piano and he put out an ad telling that I want a jazz band to play for the community. And this is a jazz band. 98 people responded. Okay. And he selected 5 of them and he made a fantastic performance for the group. So what was the difference? Be childlike, not childish. What's the difference? Being childlike is being open, being transparent, being accommodative, being learning, being humble, being trusting, willing to take a criticism, and always wanting to learn and always wanting to grow. That is childlike, always trusting. What is childish? Being fretful, being angry, being snappy, being always, grumpy about things. Be childlike, not childish, and never let the child die in you. I think one of the things that what I learned and my colleagues learned is this. I am a finite creature created by an infinite God. Okay. And it is the trust that is holding all of us together. The very fact that we are here together talking is because God was kind and gracious to us. Ladies and gentlemen, I'll leave you with 2 contrasting pictures. You can choose what you want. The music is playing. The ambience is super. Either you can be this couple who's so anxious, so fearful. Am I going to fall? Is my blood pressure going to go up? Is my BP going to go up? Am I have to meet the doctor? What will happen to me? Will I get corona? Or do you want to be this couple who just want to live the moment and enjoy the moment and have a good dance and a jingle and being thankful and being grateful to God. I think I'll leave you with this contrasting picture. I think my time has come and I'll stop there. Sorry, I had to hurry a little bit. I had to give a broader picture about what Corona has done. I want to give a broader context of it, and I'm happy to take any questions. And over to the host.
Thank you very much, sir. It was very informative and given in a very simple language, wherein we all people can really understand. Because usually when doctors speak, they always speak in their own terms, like. So sometimes some of the whatever you say, it just goes above it. But here, every point is understood. Yeah, very nice, very informative. So now the dais is open for interactive session.
I see some messages here. Yeah. Thank you,
If
madam.
anybody want to ask any question, they can unmute themselves and ask any of the doubts. Like, otherwise, I'll go with my questions which I have got. Like, Jambunathan sir, you want to ask something?
Better, I will say better you go ahead with your questions. That will be the best thing.
Oh, some of the question actually sir has
answered.
Yeah. Some more questions which I have got. Sir, you said about the DASH diet today. Can you please elaborate a little bit on that?
Well, the DASH diet says simply as that you take medication. Sorry, we take the diet which has got a high omega-3 fatty acids and high fruits and high fibers. Normally, we need 6 grams of salt to take every day. And if you're hypertensive, you just take it by 4 grams. But in this part of the world, people say no salt at all. That's crazy. And it doesn't taste good. And it makes you feel miserable. So DASH diet gives you a sort of a holistic diet, how to manage when you're hypertension. Yeah, it's in the public domain. So you just can Google DASH diet and you get it.
Okay, sir. Now coming to this COVID, this thing, there is too much talk about the black fungus now. Are there any signs where the layperson can understand? Because some people, even with some mark on the nose or some mark on the either side of the eyes and all, they are getting very confused about that. So
Sure, madam. Thank you. Thank you. I think I was expecting this question. I mean, we're talking about rainbow colors here: black fungus, yellow fungus, and white fungus. Well, I think the way media is projected is that everybody is going to get a black fungus, and any, as you said, a dot mark, a black discoloration in the forehead is black. No, but having said that, honestly, we're seeing a lot of black fungus. It's called as mucormycosis, which is there all over the place. We all have it. It's people who have taken high dose of steroids, people who have taken steroids without a proper physician's advice, or sometimes even physicians have abused it. And people who are uncontrolled diabetes will develop it. So if you're not one of those people, I don't think you should worry about it. What are the symptoms that you have? Stuffy nose, nasal discharge. But let me say this to you. This can be a normal upper respiratory tract infection. It can be a sinus congestion. So do not worry about it. But if you have any concerns, it may be a bloody discharge or maybe a congestion in the nose and things like that. But it's only in people who are diabetic, poorly controlled diabetic, on long-term steroids, immunocompromised. They are the ones who can develop the black fungus. Not everybody, no.
Okay.
But as I told you, media said all C will go to D. All corona will lead to death. So that's the same thing. Arnab Goswami, sorry, I'm picking up Arnab Goswami. I just sort of all patients will have mucormycosis, but not true. Totally not true at all. It's absolutely absurd. Yeah.
Yeah. Compared to the COVID we had last year, this year there are more number of deaths. So many are even after the treatment and discharge, like after a week or something like that, deaths are reported. So the concern over that, the reason.
Sure, I think it's founded. This concern is very much founded. I'm heading a group of 40 doctors, and we are managing COVID ward, and most of our wards were COVID. We're not seeing such a death and destruction. Yes, you're right. Compared to last year, this time there's been a severe cull. A lot of people lost life because this virus affected younger people. There were more mortality, dying, and also a lot of morbidity. That means people are becoming unwell and things like that. We've seen a pattern here. People who there was no clear set signs to say that who's going to get worse, who's not going to get worse. It's a very, very unpredictable virus. But even people who are recovered post-COVID, they're having this tiredness, fatigue, clotting, whole lot of things. I'm one of those doctors who learned early in life to say, I just don't know, because that makes me humble and just be human. There are a lot of things that we just don't know because we are learning on the job. But what we know is that this virus not only affects your lungs, it also affects the clotting system. That means it can affect your heart, it can affect your pancreas, it can affect clot anywhere else. So a whole lot of things are there. And also we know that there's something called memory loss is also there post-COVID. So there's a whole lot of things. And what I'm most dreaded about, anxiety and fear post-COVID. Everybody's checking saturations every day, although they're recovered. So it is that fear that's got the thing. But a lot of things that we don't know, madam. I think the best thing is if you have any new symptom that you're not sure about, reach out to your physician. That's always the good thing to do instead of me sort of telling something that we are not sure about and we are learning on our job. Yeah.
Yes, sir. Yeah, like to second this, yeah, like they say when they are in the home isolation, they'll be suffering from mild fever or something like that. After 3, though the saturation levels will be normal. So after 3 days, when they feel that they are not really unwell and taken to the hospital, many of them are said to be brought dead.
Yes,
Like,
yes.
we are
As I
seeing
told
some
you, I think
cases too.
it
Yeah.
is so unpredictable. So it's very hard for me to draw a pattern or algorithm for you. So yeah.
Yes,
So,
sir.
Namaskara.
Yeah.
Really, sir.
So, Namaskara. Last week, 31st year, diet and healthy aging, there was a Hindi program. I missed that English version. Is it possible to share that?
It is all
requested
the
that Madam, I requested that time
My
only.
Hindi is not good, so I wouldn't have
No.
done that program last week. So
No, I'll
my
tell you,
Hindi is
I'll
also
tell you,
equally
Dominic.
not. My
All
Hindi
the-
also is not equally.
well, I
Sir,
think
I will
I'll
share
you
you
so
the link.
Shakuntala will
I
do the
requested,
needful.
no, I
Dina
requested to share.
Dina ma'am will share you with
Yeah,
you. Sir.
yeah, sure, sir.
Yeah.
Sir, I will
Yes,
share.
no, last week I requested this. She said she will share, but still.
Mr. Narayan,
Please, please.
all the videos are available in YouTube channel. Please subscribe
YouTube,
to the Vayomanasa Sanjeevani YouTube channel. Okay. All the videos, it is organized as per language, English, Hindi, Kannada. Okay. The programs for the last 6 months, everything is available.
Thank you so much. Thank you so much.
You can freely access any program. So it is all available.
Yes,
Okay.
thank you so much.
Yeah.
Today, sir, done exceedingly well about COVID. So nice listening to new things and all that. It is
Sure, madam.
good. Knowledge is excellent. So I'm very happy to share my views on that.
So one more question.
Sure.
So for example, we read about Ankur Bhatia, a 48 years Itigo person. Like he, after coming out of COVID, when he went back for his regular exercises and when he was cycling, he succumbed to the heart attack. Like, is there any time period to
No,
recover
madam.
so that they can do some rigorous exercises like?
Well, I think all I tell them is that once you feel that your body is back to normal self, you know your body than anybody else, then start exercises in a graded fashion. Don't go sort of full thrust, just graded. There's no pattern to it, madam. But the gentleman, what you mentioned, could have died for some other reasons as well. And one of the Tamil comedians died immediately after vaccination. There's a lot of myth in that part of the world, thinking that he had but there's nothing to do with that. But I mean, media can sort of construe all these things in a wrong way. Yeah.
Then some people are keeping these oxygen concentrates at home.
That's actually wrong. I would say it's
advisable?
morally wrong. It's morally wrong. Not only advisable, it's morally wrong because you're hoarding oxygen which should have been used for somebody else. So I went through a moral dilemma like this for my mom. I said I should not hoard because somebody else will have it. Although my mom may potentially need it, but I can reach out for it, but somebody else would have had it. So that's morally wrong, madam. It does not help at all. It doesn't help. And I think things they should be doing because there's a crisis of oxygen.
Yes, sir. Yes, sir. That's true, sir.
Okay, how long do you think this oxygen crisis will remain? And
Well, I think the best person is Narendra Modi to answer that, sir. I have no thing. I have no concept of that. I don't sort of deal with that. But yes, but all I can tell you is that it's a shame that we don't have the basic thing of oxygen. But that's all I can tell you. But
I think it is better now. It has actually improved.
It's much better.
It's much better.
Much better.
I think you don't need to panic. And if
Yeah,
you are not bought oxygen concentrator. Even at this
I
point,
would not recommend you to buy, please. Why do you want to
it
buy
is
oxygen
definitely
concentrator?
not.
Yeah.
So people have profited. People have just increased the rate and profited.
Yes.
It is oxygen beds are available in plenty now. It is not at all really.
Things are eased off here, right?
People are closing
my
down.
question, doctor. Do you think that this position will continue, or again there could be a problem? That's exactly.
Well, I you know what? As I told you, I'm just a human. I just don't play God or talk God. I'm very limited. I'm very stupid. I know really, really little. So all I know is that we have gone through a crisis. We are getting better. Are we going to have this again? I just don't know. But all I'm hoping it is not. But if it comes, we better be prepared for it.
That's all. I knew we need to be optimistic.
We hope for the best and prepare for the worst. Yeah.
There's a question in the chat box. Why this time young men are affected a lot?
Well, we don't know, madam. This virus has mutated and it has affected young people as well. The answer to that question is I just don't know. Sorry, I think that's a very honest.
So it is a lot of things are kind of something which we will probably have to evaluate and then learn over a period of time. Right now, it's all hypothesis and people. I think Dr. Dominic is very humble and it's actually right. It's actually right not to claim more than what we know. But I think it's also at the same time an opposite thing should not happen. Like we should not throw our caution. It should be a balance. It should be a balance. Like when we go back, as soon as the lockdown is open, let us not be kind of throw our cautions to mind and kind of be indiscriminate. I think we have to test our waters. We have to see as to how it is happening. I think that's what doctors say. I think people should not become sick like this and kind of the health system will collapse. So
I think if somebody wants a new business venture, go for designer masks. So it's going to be there for a long time. So.
Yes, that's so true. See, anybody, they can, my questions, whatever questions I had got, I've asked the doctor. So anybody wants to question him or any doubts to be clarified, you can unmute yourself and ask the doctor.
Dr. Dominic, before somebody asks, I think anybody is there?
This is Dr. Srinivasa Murthy.
Dr. Srinivasa Murthy. Sir, just a minute, sir. I will say he is my teacher and he is our former professor. Dr. Srinivasa Murthy regularly attends our sessions. I think he had actually sent a chat message also. Thank you very much, sir, for encouraging us. And please go ahead with your question, sir.
My question to Dominic, it was a brilliant presentation. I mean, truly brilliant. I mean, it's empowering to people and also presented the broader picture. Thank you very much. It's really good. The question which I want is that a little more elaboration about the existential issues to be addressed. Because very often spirituality is sort of put in the backyard. To give an example, just last Thursday, there was a talk on disaster mental health and this question was raised and the NIMHANS faculty member, no, religion is something we don't want to touch. I don't agree with it. That's why I'm asking you to elaborate a little bit more.
Get me on for a 2-hour session. We can talk about the existential questions. We'll talk about all the existential
I'll get you on.
I'll get you on because that's a very big topic that you're touching upon. All I said is that never duck the existential questions. All I said is never duck the existential questions. You can answer at your thing. You can come to a conclusion, but get me on for another 2-hour session. We'll just only do existential questions. We'll see how the all convergence happens, and then we can take it from there. But what has been proved inconclusively, you look at the NUN study, you look at various studies, people who are spiritual do well, all health parameters. Okay, so these are proved state. I'm just stating the facts. I'm not stating things. So we can look at it, but let me say this to you. A lot of my patients questioned, am I going to die? A lot of my younger patients questioned, I felt I'm going to die. My own doctor colleague said, I thought am I going to die? I told my family this. So these are big questions, sir. I salute you. You're a senior professor and with a lot of, you carry a lot of wisdom and experience, and I'm humble myself in front of you. But yes, we can always talk about the existential questions and we can have a session only on that.
Sure, I think this is a topic for future. We'll take your suggestion, sir. I think this is something very relevant for elderly people.
Sure.
We need not shy away from discussing it. And see, actually today morning I was corresponding with Sakuntala Madam. A lot of questions she had actually sent me, and I thought you will cover more on medical aspects. And I told, I think we will utilize your time on medical aspects, but I was proved wrong. So you had actually addressed all the questions.
Well, I think I just sort of gave a flavor of everything, sort of just touch the flavor and see why people are feeling the way they're feeling in terms of COVID. Yeah.
I think it was really kind of useful, and it was, I think this is what people want. So
Sure.
many of the things what you had actually highlighted today, this Vayomanasa Sanjeevani is an initiative to address these things.
Sure.
So I think I'm happy to share that we have taken this initiative from for the decade of healthy aging.
Sure.
And last, say from October, we have been doing continuous activities. So one of the things, as you said, we have recently started an activity program called Sandhya Karanji. Again, our volunteers are leading that.
Sure.
And we had a puppet show, we had a magic show by a clown, and we had many activities we have lined up actually to share things. Quiz program, okay. So something on Mahabharata.
It's all validated by NIMHANS. It's sort of under the umbrella.
We are giving a kind of a platform for people to come, and because nobody wants to listen only medical diseases, and I think people will be happy today.
Sure.
So including my father who is attending the program, many of them don't want to talk more about diseases and death. I think what you had given the messages, actually it was very helpful, and it was helpful for me also. So good.
Stress, positive notes, maybe positive experience may be explained rather than talking corona. The thing is all people are not able to go out and speak to relatives, friends, only reading some old books. The team should encourage other people to have some fun like jokes like that.
I think I put out a very important slide. It's called the Zimmers. Just watch them. There are more than 5 million viewers. 8-year-old people dancing. It's a good fun.
So that's my father.
Yeah.
That's my father.
Sure.
So,
sure.
He's sharing his thoughts.
Yeah. Sure.
So,
thank you, sir.
One Radha Srinivas, she has
Dr.
raised her hand, sir.
he has spoken, madam.
Sure.
But my view is very, very small view. Thank you all.
Thanks.
Thank
So
you,
I think Dr. Dominic's time is very precious, and he is handling the busy COVID. What I think hopes are things are getting better.
Much better, Shivakumar. Much better.
So take care of yourself.
Thank you. Thank you.
It's a very positive note to finish, Doctor.
Thank you.
Things
Yeah,
get much better.
stay safe and
Very, very positive thing to finish a meeting.
Sure.
yes.
That's a good
Be
thing.
childlike, not childish. That's it.
Yeah,
Yes.
exactly.
Bye, sir. Take care. Thank you.
Thank you, Doctor. Excellent.
Thank you.
Thank you, sir.
Thank
Thanks a lot.
Sakuntala, would
Thank
you
you.
like to conclude? Yeah.
Yes, sir. As you truly said, sir, key to healthy aging is relationship and love. Very true, sir. So we should all keep that in mind, especially the caregivers. And thank you very much, sir. It was really informative, and we didn't know how the time went by. And we value our valuable time, as you're really,
Thank you.
during this pandemic, you're saving so many lives. Thank you very much, sir.
It will be a stress buster for you also.
Thank you. Thank you. Yes.
Good luck to doctor.
Thank you.
Meeting you, sir.
Thank you.
Yeah.
Have a nice
Yeah.
day.
Thank you,
Thank you,
gentlemen.
one and all.
Have a good
Thank you,
evening.
one and all.
Stay safe. Yeah.
Good evening. God bless you, Doctor.
Thank you so much, Doctor.
So you'll do the
Yeah. So next week, actually, we will plan to have something on elder abuse. Actually, June 15th is Elder Abuse Day. So we are planning to have a program on World Elder Abuse Awareness Day on the next, that is 14th. Please look for the program, and I think probably we will have, even in that, we will try and have a discussion as to how things can be positively addressed, rather than only talking about the statistics and issues. So we will, this is to commemorate elder abuse awareness. I request people to share this, I think, the YouTube channel, as well as the information to your friends and contacts. Now we are actually doing programs in Hindi as well as Tamil. We have started one program, and we are looking to organize more programs. And our activity forums, that again, we have done a couple of activities, 2-3 activities. We are planning to do more, and we need support from volunteers and reference from many people who can suggest us topics, suggest us activities, suggest us way how we can actually, as Dr. Dominic told, how we can actually meaningfully have interaction with senior citizens, to give them kind of an experience, and to give them say awareness, as well as something which can actually they can spend their time without adding more to their worries. And it should be a meaningful interaction, giving them activities. So we look forward to working with our volunteer groups. I thank Sakuntala Madam for hosting this, as well as all our volunteers and participants. Thank you one and all. Thank you.
Doctor, only one suggestion, that one thing you can think of is that some kind of experience sharing and storytelling.
Yes.
We have tried this with some other group. It was a grand success. See,
Yes.
anybody can come on and say that this is the experience I had, this is the story I like to share. That kind of a thing, I think people would, it will take back to the reminiscences, and they can also be brought back to the reality of today.
Yes.
That's my suggestion.
I would request you, sir, to connect with our volunteer, our coordinator, Gina.
Gina,
Actually, we can get because this is something we need to plan and do it. We would be happy to connect with you and then take this. We have thought about it. We have thought storytelling as one of the activities. We will definitely consider it, and we will plan it out in a way it will be interesting for everybody.
Yes, doctor. Thank you.
Thank you very much. Thank you.
Okay, so on behalf of Vayomanasa volunteers, I thank PT Shivkumar sir and NIMHANS for giving me this platform to do a moderate sessions. Thank you very much, sir.
Thank you. Thank you.
Thank you all for joining.
Shivkumar, can I have a word with you?
Yes, sir. Yes, sir.
Hello?
Yes, sir. Yes, sir.
No,
Please
there
go.
are three excellent books related to what has been talked today. Interestingly, all of them written by Indians living in America. One
Okay.
is Keep Sharp by Sanjay Gupta of the CNN. Excellent book about exercise, sleep, all the evidence written in a journalistic manner. The second thing is by Vivek Murthy called Together, talking about the importance of connectedness, and he is also the Surgeon General of America.
Yes.
For example, yesterday they have launched $5 billion wellness program in America. Third book is by another Indian, Dilip Jaste, who has also talked in NIMHANS, called Wiser, W-I-S-E-R. Again, an excellent book about spirituality. The fourth one is The Miracle Pill by Peter Walker, talking about the importance of exercise as a health promoting activity. All of these books are available in Kindle and other places. It's a fantastic, presented in a manner that we can change our life. Thank you very much.
Thank you very much, sir. If you can also, I think this is recorded. Gina will share it with the group, and it's a very useful message, sir. Thank you very much, sir. Thank you.
I can send the links to all of these things to your office.
Yeah. If you can send it to coordinator, it will be helpful, sir. Thank you very much, sir.
That will be great. Thank you so much.
Thank you. Thank you.
Thank you. Bye. Stay safe. Yeah.
Thank you.
Thanks, sir.
You have not shared the link, ma, for this feedback link. Gina, ma'am.
Gina.
Mr. Baba Challadurai can be invited.
Yeah. In Tamil, yeah.
Tamil
Gina, can you share the feedback link?
I think she is not there in the link.
No. She some network connectivity issue.
Yeah, she is there.
Gina, she'll be sharing in a minute. Yes.
Yeah, sharing it, or we can do one thing that I have suggested even earlier. We can just send it along with the email.
Yes. You can do that.
So that it will be easy for us. Otherwise, it's becoming difficult.
Yeah, you can do that. No problem, sir. No problem.
Yeah, once you give that link in the email itself, then immediately after the meeting, we can give a feedback on that.
I think she had posted the link in the beginning. She has not posted.
No, she has not posted.
Okay. I will ask her. I'll ask her. I think I'll ask her.
Take your time, doctor. Absolutely no problem.
Sure.
I think she is not in the link.